Hi, this is Mark Graban. Welcome to episode 36 of Lean Blog Audio. It's March 25th, 2015. Today's post is titled Lean Factories and Lean Hospitals Are Safer and They're Better Listeners. When we introduce the idea of lean to healthcare organizations, it's very common for somebody, often a senior physician, to say something like, "But we don't want assembly line medicine." Now, the implication is that assembly lines and factories are cold, rigid, uncaring places that focus on ruthless efficiency and making the numbers at the expense of safety and quality. If you do a Google search for the term assembly line medicine, the implications and what people say about this are very negative. But I think it's also a bit of a red herring for people to bring up assembly lines when we're in agreement, or at least I would hope, that our goals in healthcare are to improve safety and quality, reduce waiting times, reduce costs, and improve staff morale. Now, when I volunteer to take local healthcare students or leaders to the Toyota truck plant here in San Antonio, I always ask them, who's ever been inside a factory? Give me a show of hands. It's rare that a hand goes up to say yes. So then that leads to all sorts of misperceptions about what a factory is like, including people thinking that a factory is a simple technical system instead of being a complex socio-technical organism, if you will. That idea is born from ignorance, and it's not their fault for not understanding factories if they've never been there. And society has often portrayed factories as being full adults, like Fred Flintstone or Peter Griffin or Homer Simpson. I mean, these are all cartoon characters, but manufacturing has not really been held up as a complex or interesting workplace in entertainment. So when healthcare professionals actually get inside the Toyota factory, they're surprised or often impressed to quickly see how employees are respected and listened to as the team members reach up and pull the andon cord frequently. Getting a quick response from team leaders, allowing them to put quality first, to be able to speak up, point out a problem, and not be yelled at for stopping the line, but to have somebody come over and help solve problems. So are healthcare settings already a bad assembly line? The perception of what assembly line medicine would be like is ironically often the norm in healthcare before lean concepts are introduced. Safety for patients and staff is far worse in hospitals than it is for most manufacturing companies and products. GM CEO Mary Barra and Toyota CEO Akio Toyoda get called in front of Congress to explain a dozen driver customer deaths, which are tragic, but hospitals and their leaders somehow avoid scrutiny for all the preventable harm and death that occurs. ThedaCare, Virginia Mason Medical Center, and others have demonstrated that applying lean methods improves quality and safety while also reducing waiting times and costs. So recently, my dad sent me an article. It was a nationally syndicated column. It was in the Detroit News, and it was titled, "Let Ye Who Have Ears Use Them," where the author Ronnie McBrayer talks about the healthcare system not always being good at listening to patients. And McBrayer wrote, quote, "Listening is largely a lost art. Medical professionals run us through their offices like cattle through a chute," end of quote. Now, since a small minority of doctors' offices and clinics use lean methods to any significant degree, we can assume that McBrayer is talking about the traditional predominant medical system. In this system, appointment slots are being shortened due to pressure from payers and administrators, and patients start to feel like, well, they're on an assembly line. And this has nothing to do with lean. Well, at least an assembly line in a factory flows. As a patient, we feel more like inventory that's just sitting there and waiting, whether it's in the waiting room or the exam room. And I like to jokingly call the exam room the second waiting room. 2 years ago or so, I had to disagree with a professor in Finland who made comments at a conference about how, at least in his mind, a lean doctor's office would have some sort of tact time clock buzzer go off or ring, forcing the patient to leave the room because their time was up. Well, a lean system in a factory or in a doctor's office would do no such thing. If it took longer than planned to care for a patient, you'd do something like pull the andon cord and put patient safety, putting quality first. That's a more caring environment with lean, not a less caring one. So So a lean system listens better. If there's a lack of listening in the world, a lean environment demonstrates respect for people by doing a better job of listening. In the factory, production team workers are free to speak up with their voices or by reaching up and physically pulling an andon cord. Their concerns about falling behind in their work or having a potential quality problem are listened to. Employees in a lean factory or in a lean clinic are listened to when they have Kaizen improvement ideas. Lean companies ranging from manufacturing to startups to hospitals also do a better job of listening to the voice of the customer. This is a common lean theme. So when people say they fear assembly line medicine, I think we need to do a better job of explaining how assembly lines actually work, particularly lean assembly lines. I mean, we can all do a better job of listening. Friday's post will be about the need for the lean community to listen to quote-unquote lean horror stories rather than just ignoring them and hoping they'll go away.
Podcasts are sponsored by KaiNexus, where we're passionate about helping the world improve and innovate more effectively with our web-based software. Learn more at www.makeimprovementhappen.com.